Hello and welcome everyone to today's webinar. We're really excited to have our guest. It's a very unique situation that we have our very own founder and CEO, Jeremy Glauser, who is a bit of a pioneer in the world of teletherapy, especially in K through 12, and is truly an expert on all of the hidden values of teletherapy. We're going to talk about what teletherapy can do above and beyond just making your programs compliant. So without any further ado, let's jump to the next slide. I am George Dayton, as you know, and will be hosting today's webinar. And this is the format that we've got today. We'll do a quick introduction. You didn't come here to hear from me. So I'll try to get through this as quickly as possible, and let's get into this presentation. It's chock full of really valuable information, very insightful. And then we'll get to a Q&A and discussion at the end of the presentation. And with that, I'd love to ask each and every one of you to put your questions in the chat. We'll address those in the latter portion of the presentation. So as you have questions, as they come up, please put them there. Of course, we'd also love to remind all of you, those of you that would like to take advantage of the live transcript closed captioning feature that Zoom has. It's at the bottom of your screen. Just click on the CC button on the bottom menu. And if we could jump to the next slide. Just a little background about eLuma. If you haven't been to any of our webinars before and you don't know who eLuma is, we are a company that's dedicated to helping individuals and students achieve their full potential. And we provide systemic solutions in the areas of mental health, related services for special education, and anything that helps students learn and learn better. We were founded in 2011 and have been working fast and furiously to help students all across the country perform at the highest levels. If you'd like to learn more about eLuma, you can visit us at www.eLuma.com. If you like this webinar and like to see more of this kind of content, follow us at eLuma Therapy or at facebook.com. The handles are right there, and you can learn everything that we're up to. One last thing, for those of you who need help with speech, OT, school psychology services, mental health supports, we invite you to schedule a short demo. You can do so at eLuma.com/consultation. And for those of you who are watching this webinar and do so today, we're offering a $100 gift card if you schedule today. So just use the promo code eLuma webinars in that form at eLuma.com/consultation. This webinar, as I mentioned, is a part of our ongoing eLuma Special Education webinar series. We have several distinguished guests presenting on an array of special education and general education and mental health topics. We'll culminate this season's webinar next week with Paula Morrison. But I want to remind each and every one of you that have registered and signed up for this webinar, we will follow up with sending you a recording link so you can come back and revisit the webinar, the slide deck, certificate attendance, and possibly other supplemental materials. So stay tuned. We've got more great webinars. Please come back next week, and then we'll be kicking off the new year with many, many more webinars. So without any further ado, I'd love to introduce you to Jeremy. For those of you who don't know him or who he is a visionary, distinguished individual, and he is notably the founder and CEO of eLuma Therapy. He's made a huge difference in the world of special education, and as eLuma jumps into the world of mental health, we intend to make a big difference there. Jeremy has done so many things, but most notably, eLuma as a company has provided over 400,000 hours of therapy services to over 38,000 individuals. Personally, he's won several awards as a CEO and entrepreneur, including the Forbes 1000. He was a finalist for Ernst & Young's Entrepreneur of the Year, and has won many other awards, 40 under 40, in addition to the many awards that eLuma has won. But if you were to talk to Jeremy, he is as humble as they come, and is more proud of the fact that he is a happy husband and father of 5. He has a beautiful family, and if you know him, you would know that he's most proud of that. we could jump to the next slide.
That was a very generous introduction there, George. Thank you.
So Jeremy's going to tell us a little bit about today's presentation.
Yeah, we have some exciting things to cover. And George, I appreciate going through all those details. There are some great opportunities in the future. We'll review it again with Paula. I was able to visit with her earlier this morning, and we're getting excited about the content she'll deliver because it is going to build on what we're discussing today. Today, this is focused on a few key objectives. We want to talk about the evolution of student support services in K-12, a different perspective or a new perspective on delivery models. And we're going to do that in a unique way by comparing real cost. And I'm excited to get into what that term means and suggests. Also, the complementary and substitute purposes for a hybrid workforce. You'll hear a lot about that throughout this discussion. And then ultimately how to effectively frame a modern hybrid workforce so that it fits the purposes of your district for the benefit of your students in your program. I'm excited to be with you today. This is definitely going to be interactive. So I encourage you to pull up your chat and have your keypad ready. I will not ask you to answer hard questions, but just to offer up your experience and some insights that you might have to share. Because today we really are focused on the hidden values of teletherapy. And by the end, they won't be so hidden, if you know what I mean. So let's start with some of the things that we know today. We know that mental health counseling, school psychology, speech therapy, occupational therapy, behavior intervention, social work, and other student support services are being conducted online and remotely, and it's effective. We also have that to compare against a COVID situation where we were forced as a country into delivering services remotely, and a long-term program built with best practices is different than a pandemic response program. And you'll see some of the differences as we go through. Many assessments are available. Publishers leading the way like Pearson, Riverside Insights, and others who are making the assessments adaptable and valid through remote online delivery. That's huge for us in this profession. It's also safe to say that we're here because we're at least willing to embrace the concept of a hybrid workforce. And we know that combining on-site staff with online staff, contracted staff, is a hybrid workforce that is now, it's modern, it's being embraced across industries, and education as well is embracing it. And we need to embrace it in order to address the shortages, the challenges with burnout. There is an opportunity to really adopt a way of working that will take us much further into the future than otherwise. So my hope today is to work with you and uncover some of these hidden values together so that you can see how student outcomes can be improved. Many of these concepts are generically teletherapy, and many of them are also eLuma specific. I'll try to distinguish, but it's hard because we live, breathe, and eat every day with districts who are adopting a hybrid workforce and that approach. So let's take a moment and imagine. I want you to put on your thinking cap, and I'm going to ask for some possible ideas here in the chat. But to prime the pump, I will give you some. What if a student could have real-time access, or a family could have real-time access to their progress instead of on a quarterly basis? What if a team at a school, including the LEA, the service providers, the general education teachers, and other supporting professionals could access each other and communicate more collaboratively in real time about a student's record and their progress? What if we could bring really experienced specialists and clinicians into a district's team with this hybrid workforce, thereby offloading burnout tasks and frustration for staff in the district and creating capacity through that? what other things can you imagine? Ask yourself, what if you could, by combining teletherapy into your district? I would love to hear from you. At the bottom of the Zoom chat, or sorry, the Zoom webinar screen, there is a little chat icon. Click on that and share your idea. How can teletherapy or an online therapy or online service delivery really elevate a school district? Don't be shy. I wasn't joking when I said that this would be interactive. And if you're not brave for this question, there are some easier softball questions coming up. I'll give you another example as you think, because I really would love to hear from you. But what if we didn't rely only on the school day or the academic hours, but we could leverage really good service providers who aren't available during the school day? That would be incredible. We could then serve students outside of their academic hours. What if we could avoid pullouts and push-ins and allow students to learn from home with more parent involvement? I like that, Terry. We could decrease drive times for rural locations. We can reduce certain costs. Absolutely. There are lots of ways, and it's going to be unique district by district. This is not a one size fits all, and you'll see that clearly throughout this conversation. So let's keep going. And I want to give a little bit of background about an evolving therapy model. And many of us have been involved with therapy and student support services for decades. And we've seen this evolve significantly over the decades. But back in the 90s, we've had sufficient supply of therapists to meet the needs of our students. And then somehow we started to see the supply constrained, and contracting staff became a very prevalent model for outsourcing. And so we work with outsourced providers and to staff districts. And that's now just a way of life. It's common and ubiquitous for us to have a contracted staff combined with our on-site staff. You might even say that's a hybrid. Well, as we go forward, we're seeing that combining online staff with our on-site is the modern workforce. It's the adoption that we need to accept in order to really fully meet the needs of our students and our programming. I think that's really interesting because, it's not intended to replace or even compete with on-site. It's just an augmentation of the context through which services can be delivered. And it's a meaningful way to empower our teams and to address it. So as a society, I think it's important to recognize that we are evolving. And when we embrace the proven and tested and viable options that we have in front of us, we can be more effective in our districts and with our students. So let's take an example with Uber. I know we're going to go outside. This is an example that all of us are familiar with, but Uber is an interesting contextual use case. If you've used Uber, indicate in the chat. I can't see your hands if you raise them. So let's use the chat. Who's used Uber? Give me a yes in the chat. I would be surprised at this point if many people haven't. And if you haven't, then maybe you'll see some use cases after this as we create an interesting analogy. Okay, so a lot of you. Now tell me, how many of you own cars? Again, I can't see your hand raised, but throw it in the chat with a yes. Yeah. Yeah, so it's interesting that even with car ownership, we do use this interesting model and this concept. And throughout this discussion, you'll notice that this is kind of an underlying analogy that I'll use as a comparison. so that hopefully we can understand each other. But depending on our individual needs, we own a car, we might use a ride share service when we're traveling or when we're downtown, and we'll talk about those different use cases here, because people use it for lots of different reasons. I mean, it creates a versatility in how you get around. It can be affordable and it can save. I know that when I go downtown, I tend to use Uber so I don't have to pay for parking. When I travel, I tend to use that getting from the airport to my hotel. I was actually in Savannah just yesterday, and we were having mental health training, and I was using Uber because it's not realistic to rent a car. It wasn't realistic for me to have my own car. So using this rideshare service saved me, and it was really convenient on demand. And it's dependable, and in many cases it can be a better experience because it's so natural with an app on our phone where we're trained to use apps to run our lives and to stay connected with the world. So when we look at how people use this, the context of a complementary versus a substitute solution is pretty key, because I, like you, I own a car. We've got 5 kids. We got to take them to, piano and soccer and practice and all of these different events that we're going to. And it just doesn't make sense to use an Uber or rideshare solution for something like that. We own a car. So as a complement, people will use Uber even if they own a car. They're still able to drive, but they occasionally choose not to. They need a ride. They want to avoid traffic, parking hassle, want to be safe, prefer to offer transport alternatives. But then as a substitute, there are people, and I have friends who are in this situation, and they don't own a car, but use it to get around, can't or don't need to drive, prefer to be driven. They avoid the cost and headache of car ownership, all that maintenance and the gas and the unknowns of owning a car, the depreciation. Can still use as a desired or as needed, or you might just prefer ride sharing to other transport alternatives like taxis, rentals, or public transport, right? So the use case and the context of what we're doing does matter. And I want to compare this analogy to how this hybrid workforce and this modern workforce can really benefit our lives in districts. So as we look at these, I would invite you to comment in the chat if there's one that is missing, because I think that understanding how to combine the resources at our fingertips is what really empowers us to do what we want to do and what we want to accomplish. But let's look at it first, where teletherapy or online services are a complement to having your own staff in a district. So that's what we're talking about here. We combine staff for a hybrid workforce and can delegate duties and tasks to specialists or based on time. Specialized providers accomplishing specific functions. Think about a team on site being able to focus on delivering assessments, while a team online can focus on delivering therapy, or any number of variations in how that's broken down. Supervision and assessment supports. Avoid the recruiting, retaining, and HR hassle. Want to expand capacity quickly with precision hiring. We'll talk a little more about precision hiring because I think that's a really unique concept that we want to explore. Retain retiring staff on a flex basis. It's very common now with so many of our specialized service providers who are nearing retirement to want to stay connected and involved on a different level. So hybrid workforce as a solution can really engage those who retire from our districts. Prefer overstaffing agency because of the convenience and the ease of matching clinicians. So that's as a complement to a district staff. And in some cases, it is a substitute to have online services because there aren't the availability of staff. Maybe it's rural, maybe it's hard to access. And so when you look at it as a substitute, online services can fill all related service and mental health service needs. Can't find staff or don't need full FTEs. Again, that concept of precision hiring for a 0.3 or a 0.7 FTE versus a 1.0. Avoid costs and challenges of hiring W-2 employees. Can still get services as desired or needed long-term. It's not a short-term solution if it's a substitute. Or there's a preference over a staffing agency because of the convenience and the ease of being able to pull clinicians from any geography as long as they are properly licensed and credentialed. I'm curious if you've had any thoughts along the way. Are there other ways that you can apply this analogy of a contextual rideshare service or an online service in a hybrid solution? And if you don't have any thoughts now, I would invite you to share them throughout, because this is the time where we're trying to problem solve as a community and as schools. Let's keep going and dig in. And online therapy really can be effectively delivered. I referenced earlier about pandemics. So many have had poor experiences because COVID forced many into delivering services remotely. And the tools weren't available, the resources weren't available, the infrastructure wasn't there, students and families and staff weren't in the mindset for that to happen. It was a very challenging situation. And even still, there is emotional baggage that people carry because of that experience. And we need to acknowledge that a pandemic response is different than a long-term program where we're intentionally building a hybrid workforce to include online services. And it can be done very effectively, and it will need to be done very effectively as we address burnout and shortages and capacity in this country. So precision hiring is this concept that I wanted to also dig in a little bit more, because oftentimes in districts, we have these budgets to hire FTE for a specific department or even a specific position. And those FTE requirements are usually very strict, right? And when working in an online environment, you don't need to maintain those same strict levels around a 1.0 FTE, right? You can hire exactly to your needs and to your workload of students. So hiring can be done in smaller increments, and you can scale up as quickly or as effectively as you need, and make sure that you're fully utilizing the resources and the dollars that you're investing in your staff and in your program. That's the other point here is understaffing or overstaffing. That goes to the point of really making sure that as we analyze the caseload, we're also looking at the workload, and we're hiring to both to make sure that we have the right specialized providers to meet the needs of the students that we're trying to serve. And then specialization, the ability to pull from different parts of the country and reallocate really great professionals who are in a situation to provide services remotely. It's incredible. We get to work with so many talented people day in and day out here at eLuma, because they are in a situation where delivering remote services is ideal for their lifestyle or their circumstance. And it's exciting to think that we can help districts, and districts can help themselves to bring these people back in, meeting with their students. So building on that precision hiring concept, Single or group therapy is absolutely part of the programming. Meeting with students one-on-one and or in groups. Usually groups are sized between 2 and 3, maybe up to 4 students. It really depends on the IEP and the goals or the mental health plan that is created for that student at a tier 2 or tier 3 level. And so one of the hidden values, so to speak, is the ability to serve more students individually and meet their needs. And that stems from the efficiency of working remotely. So take, for example, a service provider at home who is not having the hallway conversations or the cooler talk. They're still part of the team. They still go to the staff meetings. They still are communicating and collaborating with those involved in the students' program. But their time is spent, more of their time is spent with students, up to what we've seen, 80% of their time with students, compared to on-site service providers, which averages in around 64-65%, according to ASHA's reporting. So the ability to serve more students individually and in smaller groups comes as a result of increased time directly with the students to provide those interventions. There are 3 hybrid models that we like to talk about and employ when we're discussing hybrid workforces that are effective. The tandem, supervised, and traditional. And we'll go into each and we'll talk about each. If you have questions, please bring them up and let's discuss them. Let's start with the tandem. The tandem model is really focused on combining an online specialized service provider and an on-site specialized service provider, not an assistant, but a master's level credentialed provider, and dividing and conquering. So you have an on-site provider who is working with this part of the caseload, and you have an online service provider who's working with this other part of the caseload. They're collaborating, whether that's the same building or just sister buildings in the same district, and so that's an important one when it comes to employing a tandem model. This one also is important to note that it doesn't require the facilitator or e-helper role, which is common in a teletherapy or online service delivery model, because oftentimes what you're seeing is the on-site and online provider working with students in the same resource room or the same SLP room or cloffice, as we often and lovingly refer to those rooms as, a closet combined with office. And Roxanne, I think you're right. I don't think that we see overstaffing nearly like we did years and years ago. It would probably be more in the other direction, where we're precision hiring to make sure that we're fully staffed. That's a very good point. So let's move from the tandem to our next supervised hybrid model. Now, this is in the event that we've got qualified SLPAs, OTAs, PTAs, these assistant level and credentialed staff who require supervision from an SLP, an OT, a school psychologist, or another qualified professional. And the supervision happens remotely through video conferencing. And the on-site assistant works directly with the students, and a computer is set up in the room with a camera, and the remote provider observes those sessions through the camera and maintains the same levels of direct and indirect supervision requirements that are required. That one, again, doesn't require a facilitator or e-helper, because the assistant is the individual on site who is working to make sure kids come to and from class. The third hybrid model that I want to emphasize today is the traditional. And the reason that we call it traditional is because the online service provider is doing all the relevant job responsibilities that they would if they were on site, from attending meetings to assessing to delivering therapy. And this model is the model that does require a facilitator or an e-helper who is physically in the building and just is a point person who works on other things, who can fulfill other job responsibilities, but is just a point of contact in the building to help communicate with the remote and online service provider. So this is probably the most common, this traditional model. Because the shortages are so severe, we're looking at buildings that need to be covered, or multiple building sites, and bringing in high quality service providers to fulfill all those responsibilities that the school needs for their kids. Again, if you have questions or comments about these, please add them to the chat. We can talk about them at the end during our Q&A. So now that we've gone over some of the effective hybrid models and we've visualized what our modern workforce look like and some of the advantages of those, we're now going to go back to what I signaled early on in the big ideas and the objectives for this, and talking about real cost. Because we oftentimes look at it in terms of just what the price is, and we need to look at it in terms of what the real cost is when we're including everything involved. So to do so, we're going to go back to the car analogy. We've got the Arrow on the one hand, and we've got the Prius on the other. One is a gas vehicle, and the other is a hybrid vehicle. And we're going to look at a comparison of the cost, and also talk about what we would choose. So I want you to be thinking, when you compare these two 2016 cars, which one would you choose? And look at the cost down, or the price down here. The MSRP is $20,000 on the Arrow, and then it's $27,000 on the Prius. And the check mark indicates that there's probably better value if we're looking at it from a price standpoint. So which car would you choose? Maybe you've actually faced this real choice. I'd love to hear from you. And this is a hypothetical. You can take either side. Well, we've got one for the Prius. We've got some votes for the Prius. I'm guessing that you are reading into where we're going with this analogy. I'm not sure if I would have chosen the Prius. I probably would choose that gas car, because the upfront is $7,000 less than the Prius, right? So my mind would probably go to that. All right, so let's look at the real cost of what ownership looks like, and we have to pull from the Consumer Reports to do so. And Consumer Reports looks at maintenance, depreciation, repair, insurance, fuel, sales tax, safety, financing, all of these different factors. And when we look at the real cost based on the Consumer Report, you don't just look at the price. So that first row is the price that we saw on an earlier slide. But then there's the cost of ownership annually, and then the 5-year cost of ownership. And so it's looking at the longevity of ownership, not just the price that we would pay up front. And the Consumer Reports actually projects the Prius would be $9,000 less over a 5-year period, which I think is quite incredible. And that's contrary to, I think, many of our mindsets, because we are looking at what we can spend today. And what I'm saying and what we're trying to do is identify the hidden values. And one of the hidden values of this analogy is the long-term nature of savings and what we can do with those. So I do want to compare that. Why wouldn't we do that same approach with student support services? You know, if we could, what would that look like? Let's answer some of those questions. So let's take a scenario. We're going to build out a very similar scenario, and I will walk through this with you. And you can see that on the left, the arrow is compared to on-site therapy, and online therapy is compared to the Prius. And we've got an hourly price that is the first line in this chart. And we might pay the equivalent of $45.93 hourly if we were to take a salary and divide that over the hours that an employee works. Okay, that's what we've done here, and we'll show you the whole analysis that we've worked on with district CFOs and finance teams. Online therapy, you might look at that from a $75 standpoint, and from face value, or just based on that hourly price, there's a perception that just going on site is better. So if we were to take the same approach with a consumer report on the car study and take a hidden values report on the hybrid workforce study that we're doing, we're looking at turnover, payroll costs, stipends, pensions, signing bonuses, travel expenses, insurance, indirect time. There's a lot of factors and variables that we absolutely need to consider. So we're going to dig into some of the real costs and define what real therapy costs look like. And then I want to show you what the output would be over a longer period of time. But we've got to make sure that we cover payroll tax above and beyond that $43 that we looked at, benefits, pensions, insurance, absences. Maybe we do signing bonuses in our district. Maybe we pay stipends. Therapist expenses. We have professional development costs. We have computer equipment and supplies, mileage for traveling. We also have the turnover and shortage to quantify. We know that in this country, we're really struggling with that. There are many different studies that quantify the cost of a therapist or service provider turning over and leaving our districts. Lori Vanderplug, the former OSEP director, presented a webinar this spring and went through so many of these points, and we're pulling from some of them. The range that these studies show is anywhere from 12 to 20% is a cost of turnover. So if you were to take the therapist salary, the service provider salary, and 20% of that would represent the cost of turnover. And how is that justified? Through loss of knowledge, onboarding time, ramp time, recruiting time, just lost time. We also see demographic shifts rising and exit attrition. We see national shortages. You're very aware of that. And it's quantified to be nearly $2.2 billion in turnover costs to districts nationwide each year. I don't think that this is surprising. It is stark. It's massive. But there are real costs to turnover and to the shortage. Let's keep going. Let's talk about the quantifiable turnover costs in more detail. We're talking about separation, vacancy, recruitment, background and credentialing. We're also it's difficult to calculate, but there are multiple models that we have looked at, including the one that Lori presented in hers earlier this spring. But in one case it could be 12%, and others it could be 20 and 30. But if we were to take a conservative approach and even use a 20% cost of turnover, that becomes significant on any salary that we pay. So the point being, we're looking at the real cost of creating a workforce that is sustainable and long-term. So let's look at some of the less quantifiable costs. Performance loss. We have impact on student achievement, the stability of our program, especially when we think about institutional knowledge that we lose, administrative headaches, compliance, or even just satisfaction across the team, our community, our families. We know that these things are real and they're really hard to quantify, but they affect us. They affect us as administrators, and that leads to burnout. And that's really tough to quantify. Our satisfaction in our jobs and our ability to really have the impact on students' lives and on the programs that we oversee is an important thing to consider. The cost of non-therapy hours. So this is something that I referenced a little bit earlier, but this is highly variable, obviously, even from therapist to therapist, district to district, provider to provider. It's highly dependent on their experience, their caseload, their paperwork, expectations, how much they travel. But many studies, including this one that we pull from ASHA, shows a 64 to 36 ratio, meaning 64% of our time is spent directly with students. And then an online ratio of a 4-to-1. There's about a 10-minute difference of therapy per hour that we have analyzed over the years. And it's not to compare, or it's not to make judgment, it's to signify the value of combining resources for a hybrid workforce that can meet the needs of our students and our programming. But the ability for an online provider to spend more time with kids, even reduce the possibility of group therapy and help students exit and meet their goals. These are some possibilities, but there is a cost related to those indirect hours that we spend. Other therapist costs, inability to hire. We see this a lot. I'm sure you see this a lot. It's very hard to have a caseload go weeks, months, or unfortunately, we've seen over a school year without services because of an inability to hire. There's the training and mentorship. There's the management support. There's obviously the overhead of supervision and making sure that we're compliant with the services we offer. So let's put it all together and use this silly analogy of a Dodge Dart and a Prius to bring this together for combining an on-site and online team into a hybrid workforce. Now, this document is going to be shared with all of you who've come today. I know that the text is very small on the screen. When you do get this, you'll be able to look closely and see what we're talking about. There are some important assumptions at the top. We're taking the SLP position as an example. In this case, we are comparing it on an hourly rate, trying to create apples to apples. So the assumption here is that the hours per year is 1350. That varies, but for the purposes of this demonstration, we've assumed 1350. And many of this data is going to vary widely based on where we are. So please take that into account, as this is just for demonstration. Also, this has gone through a vetting process with not only our own team, but also with districts and finance teams in districts to validate the data that is presented here on the screen. What you'll see here is quantifying the different areas of real cost that we just walked through in the previous screens, such as therapist compensation, which may include a signing bonus. In this case, it's zero. Compensation, in this case, we're assuming a $62,000 salary. There might be a stipend for certain certifications. There's got to be the tax and the payroll taxes. There are the benefits. There are the paid absences for sick days or leave. And then we get into the expenses like professional development, travel expenses, others, and then finally other therapist costs or things like turnover, mentorship that we've quantified in these previous slides. So when we look at comparing, we've got the blue for onsite, the green for online, and then the difference over here on the right. And we're looking at the online from in terms of what would it cost for the equivalent of a full-time, and that's at 101,000 approximately. And then you've got the cost of facilitation that's built into this. But costs such as tax and payroll, benefits, paid absences are not a cost or an expense that the district would take on. That is what the online provider would take on. And then we go down to the bottom in each of these columns, we add up the total. So for onsite, we add up a total of 140, and then online we add up a total of 135. And then we look at the hour. We have one line, which is the cost per hour for with a facilitator and without a facilitator. And contrary to common understanding, they're actually very comparable from a cost standpoint when we include all the costs that go into either hiring an employee or working with an online service provider. Again, I'm excited to share this with you so that you can dig into it more and look at this. But it's the paradigm shift of looking at a long-term hybrid workforce and how we can really leverage our budgets and our dollars to go further, and at the same time be compliant, have the providers that we need, and serve the students according to their IEP or plans. All right, so we're gonna move on from our real cost comparison with this summary, and if we were to circle it back to our analogy between a gas and a hybrid vehicle, there are potential for savings. And of course, every district is unique. Every scenario is unique, and it would have to be analyzed on a case-by-case basis. But the context for combining online and on-site service providers for an elevated program is now. There's an opportunity for us to embrace that and to meet the needs of our programs and our students. And it's a process, and it will vary. But hopefully today, I've given you some ideas on how to think about it, how to combine these providers in a modern hybrid way, and that you could visualize some models, visualize how you would structure it, visualize how you would pay for it. Of course, there's always more questions to be answered. So we're happy to engage with you and to work with you on answering those questions as you are on this journey and we're on it together. I want to thank you for your attention and your time. It's been a pleasure to be with you. I've enjoyed this time, and now we've got some Q&A opportunity. Yes, I can stop the screen share. Oh, gotcha. So if you have any questions, please go ahead and put them into the chat. I'm going back and reviewing. We've got a really good point here that, the analogy kind of gives it away. But yeah, I agree. I didn't want to hide the purpose, if that's safe to say. So I'm glad that you saw right through that. That was the goal today.
Yeah, at one point I wanted to kind of address in line with this. I don't know if this qualifies as a question per se, Jeremy, but the idea, we talk a lot about shortage, and certainly we're on the precipice of a big cliff. We have close to 50% of our related service workforce that is within 10 years of retirement. So we talk about shortage and the realities with each passing year. The workforce is shrinking a little bit with a lot of these things. But one of the things that we don't talk about as much, and I'm so happy that you raised the issue, was the issue of turnover, which is related to shortage and it's affected by shortage. But turnover in and of itself is a growing problem within special ed, that and mental health, that sometimes we don't talk about as much. And it is something that is very costly to districts across the country.
Yeah, you're spot on. As a matter of fact, I'm on quite a few different listservs, and the Federal Register just announced on November 28th this new grant program. It's called the Mental Health Service Professional Demonstration Grant Program. And this is a program where LEAs and higher education institutions can partner, apply for, I think the amount is up to 1.2 million per grant. Please don't quote me on that. I'd have to go back and revisit the details of it, but it's significant. And there is a need to invest in our pipeline, whether it's on site or online. Having great service providers is a must for us. And there are lots of organizations like CASE, CEC, NASP, who are doing a lot on the Hill and in policy and in partnership to build this pipeline. So I do believe that we have to evolve. We have to embrace and adapt what we know is effective and can be effective, which is why hybrid workforce is such an important topic of discussion today. But yeah, there's a lot of work that is being done and still needs to be done.
Yeah, I mean, it's so interesting because when you talk about the idea of shortage, which is we're all being hit so hard by, all too often when people think of teletherapy, they think of it in terms of offloading recruitment. Districts or LEAs or even schools, they can't find someone, so they a lot of times turn to a teletherapy provider. And certainly there are certain efficiencies that the technology provides, the hybrid model provides, where you can expand your recruiting base, you can expand your recruiting radius.
Yeah, I think that's exactly right. I don't mean to cut you off. I'm just excited and passionate about this, because managing a remote workforce is not the same as managing an on-site workforce. And a hybrid workforce is yet different from that, because the biggest barrier is communication and making sure that people know what success is and are staying aligned to that. So we really do need to think about the tools that we're using to bring these great professionals from wherever they are into the district to meet our students' needs. And that's why, I mean, it is important to consider the types of technology, the types of tools that combine these professionals into a cohesive space. It's also important in a time where we've got so many systems that we are streamlining the experience of the providers so that there's not so much duplicate entry. There's not so many issues of data interoperability. So yeah, we definitely have to embrace the technology that will streamline a hybrid workforce. And so there's a lot to be done. there's a lot of work ahead of us, but I'm very optimistic about our prospects because like we said on one of the slides, those who do retire are very likely to remain engaged with the right flexibility, the right circumstance.
Yeah, and all too often we tend to think of this hybrid model and how it incorporates teletherapy. We think of it in terms of as a stopgap. We tend to think of it in terms of an alternative. Some people think of it as a last resort. But when you really consider all of the ramifications, it's a really an effective tool for cost reduction. It expands capability, but the end game here is really like expanding capacity in a number of ways.
That's exactly right, George. And I do think that we have barriers, and that's natural. This is not the perfect solution for everyone.
No.
But this is a great solution for most, and so when we talk about the idea of combining the hybrid workforce, really the challenge is, we have board policies that are still written to require an on-site hire. We have staff and districts who are hesitant to embrace something new or from the outside, and that's natural. We have to understand that. And we have to help show and bring people along. And then there's that emotional baggage from the pandemic response. And many didn't have a great experience because it was very ad hoc and undefined.
Yeah, I mean, I think it goes without saying that there is a significant learning curve that comes with learning to use some of these technologies, adopting these processes, and then each and every district has their own way of doing things, and so optimizing a hybrid model for your district does take some time and some effort, and there is a learning curve associated therewith.
Yeah, we probably have time for this one question from Roxanne. And then we need to get wrapped up for people's next upcoming event. But Roxanne, that's a great question. And yes, absolutely. This is where it is not and never really will be a one size fits all. But there's a lot of parent involvement in this, and we've done surveys and research and focus groups. And again, this would be a follow-up, but there is a lot of acceptance from parents, but it is about how it's done and making sure that there's a process to identify students appropriate for the delivery model. And so consulting with the district is a key factor in getting a hybrid or an on-site and online service off the ground. There's emotional trauma or baggage from that experience, and we can't ignore it. We got to listen, and people have to be heard. The reality of our situation is this is how we will meet student needs, because there just aren't enough service providers to go around. And combining this in an effective way is where we're focused, right? We're focused on providing this as a solution to a large opportunity or a large problem. Yeah. Thanks for your participation.